having me. I'm always happy to be here. Let me just say a couple words. So the Labor Occupational Safety and Health Program, LOSH, we're a center within the School of Public Health. We're affiliated with the Center for Occupational and Environmental Health, so some of you might have heard of us. We're located not here in this building, but we're kind of down on South Campus. We do a lot of work, a lot of research and training around safety and health issues for workers in Southern California. A lot of that work is for low-wage workers, immigrant workers, those in industries that are high risk. So some of the work today that I'll be talking about kind of relates to the broader themes that we deal with in our center. And if people want more information about that, I can share afterwards. What I thought I would talk about today, our program recently just put out a report, and I have a couple copies here if anyone's interested, of some research we've done recently with day laborers in California about their experiences with injuries when they're working in private homes, in people's homes, and access to workers' comp and other resources. I'm going to talk a little bit about that today, but I want to use that essentially as a case study to really get at some of the broader issues that Brian was mentioning. So I want to focus on kind of the questions about immigrant workers and workplace health and safety, where those two things intersect and what some of the concerns are. There's a couple questions that I want to address today, and I'll use this research as a way to talk about it. So one is, how does immigration status contribute to people's vulnerabilities to workplace injuries and illnesses? The second thing is, what kind of barriers do immigrant workers face to accessing resources, legal resources to which they might be entitled here in the United States when they're working here? And then the last piece, which we'll kind of swing around to at the end, is I want to talk a little bit about this current political climate and what impact that's had, because there's been a lot of discussion about that, and a lot of concerns about sort of the political discourse and what that's doing to people's sense of security and their sort of day-to-day lived reality, both at work, in home, in their communities. So we'll acknowledge a little bit about that as well. And the other thing I just want to mention up front is I use the terms migrant and immigrant kind of interchangeably here. I know there's a little bit of some subtle differences, but so just not to get confused. So let's start with just some context first. Here's some statistics from the United States. So the U.S. immigrant population numbered more than 43 million as of 2015. It's about 14% of the total U.S. population. In terms of the workforce, right, which is going to be a subset of the whole population, immigrants make up about 17% of that workforce. Now this is nationwide, okay? This is at the national level. In California has the largest number of immigrants of any state in the country. So California's picture is a little bit different. Here in California, foreign-born workers make up 34% of the labor force. So that's twice the rate at the national level. A third of our labor force are immigrants. You see the vast majority of California immigrant workers were born in Latin America and Asia. And about 10% of California's labor force is undocumented. So we have a high proportion of folks that are undocumented as well. The other statistic I wanted to share here, I think as of the most recent statistics, half of children in California have at least one immigrant parent. So that's a huge number of young people also who are impacted by immigration in various ways. How many folks in the room here are either immigrants yourselves or children of immigrants? So that's probably half the room, right? We're sort of reflective of that here within the classroom. Where do immigrant workers work when they come to the United States? What industries do we typically find immigrant workers here? So here's a list of a number of different industries where we see high proportions of migrant workers. And this is back to the national level. So this isn't specific to California. But looking at this list, we certainly, even just sort of from your own lives moving around the world, you know that here in California we have pretty high concentrations of migrant workers in a lot of these different industries. One thing I should just point out before we go forward is there is when I'm talking here, a lot of what I'm going to be talking about is around low-wage workers, people who are in low-wage industries. There is a whole other section of migrant workers that I'm not going to focus on too much, but there is in California, for example, in the tech industry, there's a lot of what we would call skilled workers who are coming in on these H-1B visas, right, and working for private tech companies, bio companies. Those folks should be here included in these statistics as well. That's a very different kind of profile and a different kind of experience. If you're a kind of a skilled middle-class worker and you're being sponsored by a company, you're going to have a very different experience than than the vast majority of immigrants that we're going to be talking about today. So I did want to point that out. And I will say the other thing is that in terms of the kind of working conditions and work experiences that most low-wage immigrants have here in the U.S., I would go so far as to say that those experiences are actually more akin to migrants in other countries than they are in a lot of ways to professional working people here in the United States. There's very, very different experiences if you're a migrant, a low-wage migrant worker here in this country. And that impacts health and safety, it impacts working conditions, it impacts a whole variety of aspects of people's lives. So when we think about the safety and health of immigrant workers, those of us who do occupational health, there's a number of things that we are concerned about, we point to as issues that might make people more vulnerable to injuries on the job, to getting sick on the job. So a few things here. First of all, people who are immigrants tend to be concentrated in more hazardous industries. And we kind of saw that on the last list. If we go back here, industries like agriculture, construction, healthcare even to some extent, cleaning and janitorial services, food preparation. These are industries where we have garment manufacturing here too, manufacturing, transportation. These are all industries where we know the rates of injuries and illnesses tend to be higher. And if we have immigrant workers who are concentrated here, by that nature of the work itself, they're going to be more exposed to these hazards. So that's the first thing that we know helps to contribute to what we would call a kind of disproportionate impact of injuries and illnesses for immigrant workers. The second thing, which is very common, is that immigrant workers here often work under precarious employment arrangements. And I'm going to say a little bit more about that in just a minute. So let's put that to the side for a bit. The third piece here is that immigrant workers, you're coming from another country and you're working here, you might have limited knowledge of the rights you have as a worker here in the United States. That's certainly going to impact the kind of protections you might be able to advocate for yourself. And then finally, immigrant workers tend to be reluctant to report concerns when they might encounter concerns in the workplace or to exercise these rights. So maybe people know that they have rights on the job, but because they don't want to lose that job, because they might be afraid of deportation, out of sheer economic necessity, people might be very reluctant to speak up if there's a problem or if they are injured. They might not say anything at all. So I wanted to share this chart with you because I think this gives one illustration of this disproportionate impact that injuries and illnesses can have on immigrant workers. So this is a chart from the Bureau of Labor Statistics, which puts out annual data on the number of workplace fatalities and injuries. This chart is showing the fatal work injuries among Hispanic and Latino workers, and we're looking, here are the buttons are. We're looking here from 2003 to 2015, okay, so a 12-year period. And the bars, the yellow part of the bars are native-born Latinos, and the blue part of the bars are foreign-born. So what do you notice by looking at this chart? What jumps out to you in terms of the patterns you see here?
Double the amount of injuries and fatalities.
Okay, so that's the first thing, right? If we're looking, remember, these are all fatalities, so just fatalities. Year to year, it's about twice the number of fatalities among foreign-born Latinos as it is among native-born Latinos. And remember, what did we say was the proportion of undocumented workers in California, for example? It was only about 10%. So if this were reflective of the population as a whole, we should really see only about 10% of these fatalities for foreign-born workers, but in fact, we're seeing almost twice the number.
Is this is the foreign-born considered undocumented as well, or is it foreign-born, undocumented and documented?
True. Okay, that's a good point. Actually, these are probably a combination of both. So these are foreign-born. So they could be here legally. They could be here in an undocumented situation. Anything else you notice here about this chart? I think it's worth pointing out. Yeah. Yeah. Go ahead.
It just looks like there was some progress made, and then it's gone right back up to really high.
Okay, we're high here again, right? We were sort of high in the, sort of the mid-2000s, and now we're back here again. What was likely happening in here? The recession, right? So if you think about the industries where a lot of Latino workers are concentrated, particularly things like construction, manufacturing, A lot of that dropped off after the economic crash in 2008, 2009. So a lot of job opportunities disappeared. So we made some progress, but we also, that progress might have come at people's economic security. So we would need to dig into that a little bit further to figure out whether we want to praise that trend or not. But certainly the rise that we're seeing again is not one that we want to see. Okay, so before we move on, I just want to say a couple things about this issue of precarious work. I mentioned to you that immigrant workers tend to be concentrated in more precarious types of employment. There's a variety of different terms that people in labor, sociologists, others use to describe precarious work. The general idea here is that if you think about what we would call kind of a standard employment arrangement, where you have an employer who hires employees and has a certain kind of relationship with those employees. They provide a set wage or salary, there's benefits, there's kind of an expectation of an ongoing relationship between those two entities. Precarious work is, in a sense, is the opposite model, is a different model. So in these situations, people don't have that kind of relationship with their employer. So we might refer to it as part-time work, temporary work, contract. There's a lot of discussion these days around gig economy kinds of work, that sort of Uber model where people are working for online companies, and there's that relationship that's kind of mediated through technology. In a lot of different ways, these kinds of work arrangements undermine workers' ability to seek protections when they're in, say, in a hazardous work environment, or the kinds of responsibilities that the employer feels towards their workers starts to erode, because that solid relationship of employer-employee doesn't really exist anymore. We'll talk a little bit more about this in the context of day labor. I'll give you a couple of concrete examples, but I wanted to at least highlight for you that this is sort of a pattern we see quite a bit with immigrant workers across a whole variety of different industries. More and more people are being hired in these ways that kind of fall short of that standard employment arrangement. Okay, so that's the groundwork I wanted to lay, and what I'm going to do now is I want to turn specifically to some of the research we've done here at LOSH around day laborers in California, and I'm going to talk a little bit about day labor as a type of work and some of the concerns there, and then where this research came from, and then some of our findings. So I imagine a lot of us are familiar with this model of day labor work. These are they tend to be men and immigrants who gather at hiring centers or maybe outside like a Home Depot or on sidewalks looking for daily work, right? They're being hired by homeowners, maybe they're being hired by contractors, they're being hired by small businesses to carry out specific kinds of tasks. Often those tasks are very limited in nature, so people might just be hired for a day or for a week to carry out a certain kind of project. We know here, there's been some studies that have happened through the UCLA Labor Center and other folks here at UCLA and in other places that there's a lot of labor law violations that are seen within this industry, that a lot of folks who do day labor work will report that their employers don't pay them at the end of the day, that they threaten them with retaliation if the workers say that they want to speak up about it. There's a lot of abuses of labor law that happens in these kinds of work arrangements. But there's been a longstanding question about injury experiences for day laborers. So there's been less study about what happens to workers when they are injured, what kinds of hazards do they face in this work, and that for us was really the launching off point for this study. There has been some research that's found that, I think this was in the Pacific Northwest, that about 1 in 5 day laborers experience a serious work injury every year. So 1 in 5, right? That's 20%. That's a pretty high rate, I would say. And when we started talking to our partners here, who I'll describe in a second, they kind of wanted to dig further around that. They wanted to understand better, well, what kinds of work conditions are people facing when they go out to do this day labor work? What kinds of injuries occur to people? And then do people know that they have access to some resources if they are injured? This is another sort of big issue which there's some worker advocates who really want to start to address. And so they kind of approached us to help gather some data that would help address that. So in this case, I want to just say a couple things about workers' compensation, because this is the program that, so let me say a few words first of all. Workers' compensation programs are set up by states Okay, so California has a workers' comp program here. And what workers' comp is it's a requirement that all employers have insurance so that if they have injuries to one of their employees, that insurance will pay for wage replacement for any time they might lose from work or medical benefits if they need medical care. Okay, so those of us who work here at UCLA has workers' comp program, and if we're injured in our job, we can turn to the university, our employer, and get workers' comp benefits from our employer, in theory. There's a lot of problems with this program, but in theory, that's the way it's supposed to work. The other piece, which is kind of maybe a little interesting side note and worth talking about afterwards, is that under this program, if you're an injured employee and you access workers' compensation, you also are relinquishing your right to sue your employer for negligence. So this was what was often referred to as kind of a grand bargain when these programs were set up, because the idea was employers didn't want to be sued for huge amounts of money by their workers when they were injured, and that often those lawsuits would lead to amounts that were unpredictable. So these programs, employers agreed to set up these programs and say, okay, well, at least we'll have some predictable costs if people are injured, but in exchange, we don't want all these costly lawsuits anymore. So it was sort of a bargain. Workers got something out of it, employers got something out of it. If we start thinking about day laborers, there's actually some very interesting little footnotes in California law which allow day laborers to access workers' comp if they're injured. So there's two things I want to point out here. One is that California Labor Code specifies that workers' comp eligibility extends to any person, and here's the quote from the law, any person in the service of an employer under any appointment or contract of hire or apprenticeship, express or implied, oral or written, whether lawfully or unlawfully employed. So a couple things stand out to me about this quote. One is that if we start thinking about that day labor relationship where someone's being hired on the sidewalk and there's just sort of an oral agreement, like, come on and work for us for the day and you're gonna, we'll pay you $500 to do whatever. That's an oral agreement. That California law covers that. It says, well, if you've hired someone and that's the agreement you have and that person's injured, you are obligated to provide workers' compensation to them. The other thing here, lawfully or unlawfully, that also could extend to undocumented workers, right? That language has been used to argue that it doesn't really matter what your immigration status is. If you're working as a day laborer, whether legally or not legally here in the United States, you are eligible for workers' comp if you're injured. So that's the first piece, which I think is interesting to keep in mind here. The second piece is that there are also some details in California law specifically related to homeowners and tenants who hire day laborers. So if I were to hire some day laborers to move, for example, if I need a few folks to help me move, I may be obligated to pay workers' comp if someone's injured. There are some earnings and work time criteria. People have to have worked a certain number of hours or earned a certain amount of money. But once those thresholds are met, homeowners are also obligated. So these become very interesting because when we're talking about rights, legal rights for workers, these are the pieces that extend to day laborers. And the question now becomes, okay, so not only how often are day laborers injured and what kinds of injuries they have, but how often are day laborers able to exercise these rights? The law is relatively clear, but it's not really clear that any day laborers are even accessing these resources. So then what's going on, right? What's that discrepancy? So that's really the core issues that we were trying to dig down on in the research we've been doing. So how did we do our work? So the project was a collaboration between our program here at UCLA-LOSH, and another organization called the National Day Labor Organizing Network. This is a national program. They're actually based here in Los Angeles, and they're an advocacy organization for day laborers. So they do a lot of political work around day laborers' rights in the workplace. They've supported a lot of this research around wage theft and other issues. They were the ones who came to us and said, hey, we would really love your support to do some more research around day laborers and health and safety issues. So NDLON has a number of affiliate organizations here in California. I think there's 6 or 7 here in Southern California, another 9 or 10 in Northern California. And they worked with those groups and they said, okay, we want to work with you guys to recruit respondents for this interview that we're doing, these interview surveys. So together, our two programs, we developed a survey tool. We did it in English and Spanish. It included a whole bunch of questions, both closed and open-ended, so some quantitative data and some qualitative data. As I just mentioned, we recruited day laborers through those affiliates, those NDLON affiliates that were located both here in Southern California and in Northern California. We had 3 bilingual interviewers who went out to each of those affiliates and did interviews with people. And each of the interviews we did, interviews took about 30 to 40 minutes, and afterwards people received a $15 Target gift card as an incentive, so acknowledging the time that people spent to provide information to us. So in the end, we've collected data so far from 106 respondents, both here in LA and in the Bay Area. And you can see some of the characteristics of our sample. And these, this really does reflect the fact that we're talking about an immigrant workforce pretty solidly. So 93% are male, mean age of 47 years, 97% Latino, 97% Spanish speaking. You can see here the breakdown of the countries of origin. One of the things I think is really interesting about this in particular is that about a third of our respondents here, you see, have been working as day laborers for 10 years or more. I was really surprised to see that. I was not expecting to see people doing this kind of work for so long. But this is, quite an astounding number of people who've been really at this for a long time. And I think, to some extent, I think this really speaks to some of the barriers immigrant workers face in moving into other industries too. It may be the case that a lot of these folks have been in this industry for a long time simply because there's not a lot of other work opportunities for them. So let's see. I want to tell you a little bit about what we've asked people about the characteristics of their work. So this is going to give you a little bit of a sense of kind of the types of working conditions people face. So we asked about most common tasks, and you can see here when people were doing day labor, most commonly they're hired to do construction kind of work, moving or hauling, gardening, and on down. This is sort of the order in rank order. And then we asked people, what kind of hazards do you face while working as a day laborer that you believe could injure you or make you sick? 90% of people indicated heavy lifting. That was sort of the most common response. Working from heights, dust or fumes was sort of interesting that was as high. But again, you can sort of see this in rank order. We also asked, incidentally, I don't have it up here, but we asked people how often, we asked people whether they had ever been pressured by an employer to work in dangerous conditions. And 2/3 of respondents said yes, they'd been pressured at some point by an employer to work in dangerous conditions. And here, I want to just share a few quotes from those open-ended questions, because this gives you a sense of what people told us about that pressure. Someone said, the employers don't have respect. They tell us to hurry, they pressure us, they want us to work with dangerous equipment without providing proper protection. This person told a little story. I was installing installation, was not given safety equipment. After asking my employer for it, he told me no and threatened not to pay me if I refused to keep working. So those are some of those kind of the threats and retaliation that folks experience. A lot of employers take advantage of the fact that I'm undocumented, or I can't tell them no because I don't speak English. So again, kind of going back to those factors we talked about earlier, I mean, these are kind of clearly in line with some of those issues that we talked about at the beginning. So the core of the questionnaire that we asked folks was about work-related injuries. In order to be eligible to participate in this study, people had to have had some serious work-related injury as a day laborer within the last 5 years. And so we wanted to ask a lot of questions about what happened, what those injuries were all about, and then what happened to them after the fact. So here you can see, first of all, the nature of the injuries. We asked people, what happened to you? 70% of folks indicated that injury that they experienced was musculoskeletal, so pain in the back, shoulders, neck. Often, it could be from falls or could be from lifting heavy objects. Cuts or lacerations were sort of second, but much further down. We even had one person who indicated an amputation, and I have a note here about this one. This was someone who was working in he lost a finger while working at a warehouse that was processing fish. So he'd been hired as a day laborer in this processing plant. And he'd been hired not by the warehouse owner, but by a temporary job agency. So this gets back to that precarious work. The employer is not the company itself. The employer is some third party that's outside of the factory and is just sending in day laborers for work that has to happen. And so in this case, this person experienced a pretty serious results for that. And then you can see questions about what type of work site when they experienced their injury. So more than half were in residential and private homes. So most of these people were probably hired by homeowners. Actually, we know they were hired by homeowners. We did ask that. Less commonly, we have construction sites, warehouses, other places. And then this I also thought was a really interesting results here. We asked people, what do you think contributed to this injury? What caused this? And most commonly, people were talking about fast pace of work was the most common, right? Repetitive motion second, heavy lifting third. I mean, I think, those of us who say, like the IH students in here, or others who do kind of occupational health, I mean, I think we recognize fast pace of work as a concern, but it's not necessarily something that is often thought of in kind of the traditional occupational health and safety model. And so it's sort of interesting to me that this was such a common response that people were indicating. Certainly some other hazards that folks are pointing out. The other thing I think is really interesting about this is the lack of training is really here at the bottom. I think a lot of folks in this field might point to training as like the key intervention, right? We need to train workers about how to do their job safely. Well, the fact of the matter is these folks, on the whole, were not saying that training was a problem. That's not really what was contributing. It was a lot of this other stuff that ultimately led to their injuries, at least from their perspective. So again, a couple of examples here of injuries that people shared with us. This first person, I was working in a cellar and another man was driving a forklift. Without noticing, he knocked over some nearby boxes, which ended up hitting me. I fell on my back and hit my head and I was unconscious and they called an ambulance. I was cutting trees and the ladder was not secure. Held onto the branch and fell along with the ladder and the branch. A cable tore into my skin and I ended up with a large cut on my hand. And then this third person, I was unloading rolls of fabric from a truck and one of the rolls broke free. It pushed me. Instead of falling backwards, I jumped and sprained my ankle. So we collected a lot of qualitative, accounts like this, stories of what happened to people when they were injured in their workplace. Oops, I forgot I had these guys. Okay, I'm going to share just a few more results from this research. So we asked people about medical care, whether they received medical care after their injury. And so you can see here, 80% did receive some sort of medical care, so a fairly high number. And we asked people if they did get medical treatment, where did they go? So you see here, most commonly people were using public clinics, some emergency rooms. These, those of you who might be familiar with sort of the Latino community, the sobadores are kind of like local healers, right? Folks that people might go to. They just sort of do massage treatments and other things. So you can sort of see that. And then we asked people who paid for those medical bills when you had to pay. So 27%, over a quarter, had to pay all or part of that out of pocket. And here you see at the bottom, we asked people how much they had to pay. So half of our respondents paid $80 or more for their medical care. The most expensive treatment that people said they had to pay out of pocket, someone said he had to spend $15,000 for his medical bills over the course of who knows how long as a result of that injury, right? So this is all now on him and his family. In some other cases, the employer paid the doctor directly. There was some health insurance involved. There is workers' comp here, but it's a very small percent, right, 8%. So here, this gets back to this question about workers' rights and whether people are able to access resources that they may be entitled to. And then we asked folks whether they lost work days as a result of their injury. So again, almost 80% said yes. And you see here, 70% were never paid for that lost work time. Median number of days lost from work, 8 days. So half of our respondents lost 8 or more days of work. And if you think about this in terms of economics for a second, that's a lot of money that people are losing. So in addition to having to spend on medical care and whatever else, these are days they're not earning money that they could need to pay for themselves and their family. Again, workers' comp rates are very low here. I'll just share this really quickly. We also asked people, what impact did this injury have on you and your family? And some really, really touching stories here. You can see this person didn't work for days. As a result, I didn't have money for food or rent, and I still have pain in my back. This person continued working because he needed to pay bills and support his family. So, I think there's this very serious economic need that really drives people's decisions around these things. I think a lot of folks are not losing work unless they really, really, really have to. Family came together to help me out since I had limited mobility. This one I think is really a sad one. It's left part of my life disabled. I was a healthy man and now my whole body hurts. I come here to this job center out of necessity and to feel not so much stress at home, but I'm seeing a psychologist because I find myself dreaming about ugly things. An accident like that destroys you. So these are also voices of workers that I think are not often heard, and both LOSH and NDLON are really happy to have been able to kind of collect this data and really hear people's perceptions of what happened to them. So just to get back to the workers' comp piece for 1 second, so we did some calculations based on, were you working for a contractor, were you working for a homeowner, and who was likely eligible for workers' comp when those injuries happened. So we found that 71% of our respondents was likely eligible for workers' comp benefits under California law. That included nearly everyone who was working for contractors or small businesses, and it included maybe about a third of the homeowners. Remember I told you there were some work time and earnings requirements. So the homeowners one was a little more complicated. But now compare these numbers. So we have 71% who were likely eligible. Only 24% said they filed a workers' comp claim when we asked them, and then only 5% indicated that in some way workers' comp paid for their either medical bills or lost work time. So this is a huge discrepancy between these two numbers, right? And the real question is, like, what is happening there? Why are so many people falling short of accessing these resources to which they might be entitled? And in order to get at that, we're going to swing back here to just get back to those 4 points I raised at the beginning about the way in which migration status tends to impact people's safety and well-being in the workplace. So these are the same points I laid out earlier. Remember, the first one was we know immigrants are concentrated in more hazardous industries, and we saw that here in this sample. As we said, 97% of these respondents were from countries outside the United States, so this is a very highly concentrated migrant workforce. 97% said that they spoke Spanish as their primary language. 3/4 indicated that their English was not especially good. And we sort of saw that in one of the earlier responses too, people being concerned about not being able to speak up because of language barriers. The second issue, which I had mentioned early on, right, people working in precarious employment arrangements. Well, in this case, we know most of these respondents were paid in cash. There were few written work contracts. And that kind of nature of someone just being hired on the street corner or hired at a work center for a short amount of time, that it's clearly not a standard work arrangement. You're not sitting down across the table with your employer and signing a contract, signing paperwork, and establishing a solid work relationship. This is temporary, it's casual, it's informal. And what this is doing in a lot of ways is really confusing for both the workers and the employers where responsibility lies. So there's a lot of indications here that when an injury happens, the worker doesn't necessarily know they have any rights. The employer, especially if those employers are homeowners, they also often don't really know that they have rights, or that they have responsibilities, rather. So when we get back to, for a second, these, I'm going backwards? I'm going backwards. Sorry, we're going to do it this way. When we look at a lot of these kind of responses about, like, who paid for your medical care, for example, this issue of the employer paid the doctor directly or gave me cash, in a lot of ways, these responses, to my eye, as we've been looking at this data, is an indication that homeowners, maybe they want to do the right thing, but they don't know what that right thing is. So maybe they're just giving people a wad of cash and saying, go find your way to the emergency room, right? And pay for it that way. Or maybe they're helping them take them to the doctor and they're paying there, but they're not using that kind of structured workers' comp resources that are set up for these mechanisms. And not that this is necessarily a bad thing, but I think it's a real important question about people's access to resources to which they're entitled. So let's get back down here for one more second. Okay. Was that this? That was this. Okay, so the third point, remember, which we had raised earlier, was the immigrant workers tend to have limited knowledge of their rights as workers. So again, we sort of see that in a lot of the responses and people's descriptions about what happened to them. This, I thought, was also kind of an interesting quote. We'd ask someone, well, why didn't you tell your employer when you were injured? Why didn't you let him know? And he says, well, one takes one's own risk when you're doing this work. And to me, that sort of indicates, like, well, it's not really about me as a worker and knowing what my rights are. I'm responsible. you know, this kind of acceptance of like, well, what happens to me happens to me. It's just sort of the nature of this, and it's not really about exercising legal rights. And then finally, this point about reluctance of workers to report concerns or exercise their rights. It's interesting, I think, in this sample, 3/4 of our respondents said, yeah, I did tell my employer when I was injured. So this actually is a relatively, I would say, a relatively high number. So employers often knew that an injury had happened, but then it doesn't seem to lead to access to those workers' comp resources. Those who said that they hadn't reported, however, a lot of them talked about fear of missing work, fear of losing their job, in some cases perceptions that these injuries weren't even serious enough to report, right? So thinking, well, it's not going to make a difference anyway. So I think we do see a lot of this fear, a lot of these concerns when we're talking to people about why they might not have reported, but a lot of people did in fact tell someone when something happened. So I guess I want to stop here for a second and ask if folks have questions or comments. The last couple minutes I want to turn to kind of the issue of the current political climate and potential impacts, but since we're moving on from the actual research, I thought I'd give people a chance to ask.
So I noticed that you said that 24% of the workers actually applied for workers' comp the claims.
Right.
And only 5% received benefit, like workers' comp benefit. Was there a discrepancy in terms of like why only 5% versus like 71% being qualified?
Right. So there's a couple things happening there, I think. One is that 24% did file claims. Not all of those folks filed claims with their employer. A lot of people said, well, after I was injured, I called the lawyer's number on the bus, right? And that person hooked me up and I submitted paperwork. Or they went to, through other means. So I think in some cases, those cases probably just didn't pan out, or there were sort of problems. In some cases, some of those cases hadn't even been closed yet, so there were some pending cases. And I also think there's a little confusion among our respondents about what workers' comp is and how to, even sort of how to recognize when that claim comes through. Because when we ask people, did you file a claim? Yeah, I filed a claim. Was that claim accepted? Yeah, that claim was accepted. And then who paid for your medical care and your lost time for work? Well, no one paid for it. So, but you said your claim was, so I think there's some confusion about like what is workers' comp and what does it mean to have a claim accepted and to receive those resources back. So that I think is a lesson for us also as we continue the research. I feel like we need to do a little bit more, in a way, a little more training with our respondents about what that program is and what it means to go through it, and then really have a better solid understanding of whether people actually access those resources. Other questions or issues people want to just raise? Yeah.
I was wondering when there was a work-related injury occurred under oral complaint, and who has an obligation to prove that oral contract
Yeah.
was existed?
That's a really good question, I think, and one that we're kind of trying to figure that out, to be honest. I mean, that's exactly, I think, another challenge here is, yeah, the law says an employer is obligated, but in reality, it could just be a worker's claim that, yeah, I was working for this guy, versus the employer saying, I have no idea who this person is. And so, an oral agreement is a very easy one to deny. And I imagine there's a fair bit of that happening here as well. So, yeah, I think it's a really good question, and it's one that I'm trying to get in touch with some lawyers who are familiar with workers' comp law to sort of figure out. So, what do you do in that kind of situation? How do you make the case that this person actually was working for that employer? Yeah.
I remember about this specifically addresses, but who typically are the employers of migrant workers? Like, how they disperse versus tenants and homeowners versus industry companies, I guess. And regarding this might go into the current political climate, like what are their risks and possible legal or illegal backlash that they can face,
Right.
and how that might penetrate into this whole thing.
Right. Yeah, I'll talk about a little bit about that in a second. But in terms of the employers, we do know, at least among our sample, about half of these folks had been hired by homeowners when they were injured. The other half were being hired by it could be a range of employers here. So it could be, say, a residential contractor. A small contractor goes in and does painting or maintenance or construction at residential homes. We saw a fair number of people who've been hired by warehouses. So this, I think, is a common thing that happens here, particularly in Southern California. We have a lot of warehouse facilities here in our city, in our region. And I think a lot of those companies are relying on a day labor workforce to go in and get work done. So we had a fair number of people who said they were hired by that. And in those cases, they're often, I think, being hired by temporary job agencies. In other cases, they were like, people were said they had been hired by like a retail owner, a small store owner. Anyone really can hire a day labor. But I would say the most common employers are going to be either homeowners or those small contract companies that are doing kind of construction, landscaping, maintenance kind of work. Maybe one more and then we'll move on just for the time.
So my understanding in your way of recruiting your interviewees was that you're going to sites where there's day laborers who are being hired.
Mm-hmm.
So you don't have any representation of those workers whose injuries were so severe that they cannot return to work or they died.
That's right.
Do you have any idea how extensive that is among day laborers?
Yeah. It's a really good question, and I don't really have an easy way to answer it. We knew that was a limitation, that there certainly is a group of people who've kind of fallen out of this workforce just by virtue, for whatever reason, but in part it could be because of serious injury. The problem is it's of such a difficult population to study, right? So it's very hard to get a sense of how many people sort of experience those kinds of injuries that are serious enough for them to sort of just move on or move back to their home country, which is another thing. A number of people did say, well, what I really wanted to do at that time is to just move back home because I knew I could have support, I'd have more support there. It's a really hard one to grapple with. So let me just say a few final thoughts, a few final words just about this current political climate, because there's a number of things that are happening here. The first thing I guess I want to just say is that the conditions for migrant workers have always been challenging. And yes, it's true that there's a lot of challenges now, but in a lot of ways those challenges haven't changed. The kinds of pressures and threats and challenges that our respondents were reporting from injuries that have happened in the last 5 years, those were all happening before our current administration. Most of our interviews actually took place before the current administration. So from that point of view, there's a certain amount of continuity, unfortunately. That these migrant workers are still dealing with challenging situations. However, that being said, we've had a lot of rhetoric at the political level about the need to get rid of undocumented immigrants from this country, the need to suss people out. And there's a lot of indications, there's some indications that that's having a real chilling effect. So this is an article that just came out last week, which I thought was an interesting one. It says, injured on the job, undocumented workers are wary of legal help. So this is a whole account from workers' comp lawyers saying, our business has really dropped off because workers who might have come to us for workers' comp claims, who are immigrants, documented or undocumented, are suddenly much less likely to come. Or we have clients who are stopping with their proceedings, with their workers' comp claims, because they're afraid of immigration issues. They don't want to be on the radar of the federal government. A second interesting issue, I think, is that we haven't really talked in here at all about OSHA and sort of the role that OSHA programs play in terms of keeping workplaces safe and trying to prevent these kinds of injuries. But NDLON has been getting funding from OSHA to do training with day laborers around safety issues, and it's called OSHA 10 training. People go through a 2-day class and they get a card that says, "I've completed this training," and that card is great because they can then in turn use that to maybe get better jobs. You can use that and say, "Hey, look, I've been trained. Maybe I can get hired by a more legitimate construction provider." Here's the problem. Those cards are issued by OSHA, or at least the perception is they're issued by OSHA, a federal agency. NDLON is suddenly finding that very few of their members are interested in taking that training anymore. It's not because they don't want training. they don't want their names to go into some database somewhere where they don't even know where that is. They don't want it to come back around to them. So NDLON is now struggling with this issue of, well, maybe we need to turn back this grant funding entirely because our members, because of the nature of the requirements of this training and the need to have those cards, our members are not interested anymore. So that's, I think, a really chilling impact on the kind of prevention side, right? If we're arguing that people need knowledge about how to do that work safely, this is getting in the way of them accessing that knowledge, and that's not a very good thing. The last thing that's happening, and this is my final thought, my closing thing, is that there's a lot of concerns, and these actually are long-standing concerns, but they've been renewed under the new administration, concerns about collusion between different government agencies. So if we have the Immigration and Customs Enforcement, ICE, which is charged to carry out enforcement of our immigration policies. ICE has a history, a little bit of a sordid history in the past in other states, I don't think it's happened here in California, where they've gone into workplaces disguised as OSHA agents, saying, hey, we're just coming in to check out the safety and the work conditions here in your facility. And then when they get in, they carry out a raid. So a lot of worker activists around the country right now are stepping up and saying, look, we need to put pressure on our OSHA programs to commit to not working with ICE at that level, that there has to be a firewall. The work they do is about working conditions, and everyone who works in this country is entitled to have a safe and healthy work environment. That should be completely separated from the work of ICE. And the thing that I just want to mention to you all is, if you're interested in this, April 28th is coming up in, a week and a half. That's Workers' Memorial Day. Here in Los Angeles, a whole bunch of worker advocates are actually organizing an event where we're going to go downtown to the COEH offices and hold a press conference around this very issue, to push COEH to say, we need to create a firewall. You will not cooperate with ICE on immigration enforcement. The COEH remains independent. So if people want information about that, I can get it to you and distribute it next week. I know that I was looking for a flyer, we didn't have it by today. But this is very much sort of a hot issue that's unfolding now. And so anyone who might be interested, that's really a way to get involved and learn more about some of these issues as well. So with that, I know I've got to wrap up here, but here's my contact information if anyone has any questions. If folks do want a copy of a report, I did bring a couple here. And I think that's it.
Thank you.
Yeah, we're good. Yeah.